Hello, hi, welcome, welcome. My name is Erica LaShawn. It is September 22nd, 2022. It is 7:39 p.m. I'm back again. Hello, welcome. If you're new, welcome. If you're not new, welcome. Thank you. Everybody's the same here. So today, some of my topics, I sit on them. I really do. I really do, because I don't have enough knowledge, or sometimes I'm afraid to talk about stuff. But I'll get over that. I'll get better. Today I'm talking about, the term is called quackery. Or quack doc. We're talking about doctors here. So I have a high respect for physicians and doctors and in the medical profession, because they do things that people don't do. Let's just cut to the chase. I could never be a surgeon. I can't cut into any body. Nurses. My hat goes off. People have told me what I used to do. I can't believe I was a CPS worker for 11 years. People was like, I can't believe you do what you do. I'm like, yeah, I know. So there are different professions that firefighters, police officers, there are different people that have professions that you'd be like, all right. So quackery, that's in Wikipedia. There's a term. So aside from that, I wanted to talk about this because I am afraid of, I'm not afraid of it because I don't do surgery a lot. I've never been, in surgery before. But there are people that, practice and they are untrained, just like anybody else, just like anything else that you do, and they skipping around in the medical profession. And I always thought it was strange that medical providers don't have mandatory drug testing. But if you want to go get a job at the post office, you up and down. Yeah, you smoked some weed 6 months ago. You're done. You're done. But this doctor can operate on you and cut you open, and we don't know what they're doing whatsoever. Okay, so here we go. Quackery. Now, it's called quackery. I call them quacks. Quackery, often synonyms with health fraud, is the promotion of fraudulent or ignorant medical practices. A quack, Q-U-A-C-K, a quack is a, quote, fraudulent or ignorant pretender to medical qualification or credentials that they do not possess. A charlatan. Charlatan means fake, fraud. Go sit down. Okay. A charlatan or snake oil salesman, unquote. The term quack is a clipped form of the archaic term quackslaver from Dutch, Quacklaver, is quote unquote hawker of slave. In the Middle Ages, the term quack meant shouting. I have 15% shouting. The quackers sold their wares on the market, shouting in a loud voice. Okay, So, my phone just said 15%, which is okay. Because I can still keep the visual black. There's a little shutter on my phone. So let's move this. I have a little door, a shutter on my phone. So I could walk around if I wanted to now. Okay, back to... Okay. Alright, so the reason why I picked this topic is because when you go into facilities where there are healthcare providers and things of that nature, you want to think that your best interest, you want to think that they want to do good for you. That's what you think. That's what you want. You hope that, okay, there are people that go around like I'm about to do. I'm about to walk. There are people that go around. I'm no longer chained to the bed anymore. There are people that go around and practice on you and do medical procedures on people and they're not qualified. So, quackery. And we're going to get into, it's something else I want to talk about. Whatever. Fake surgeon caught. Others let him slip by. So, okay, so back to this whole quack doctor stuff and quackery. And we'll get into BBLs and stuff, because that's what we are. Brazilian butt lifts and stuff like that. I'm moving around. I'm free. Plastic surgery, breast implants, stuff like that. So, you got to be careful, because you'll mess around and you can get with somebody that's not even trained for that procedure. So, fake surgeon caught. Others let him slip by. So this is from Relius Media, Relias Media, Radius Media, and it just talks about this topic. So, excuse the flipping. So, this person, Dennis Edward Rock, R-O-A-R-K, Rock. They put doctor in parentheses. He practiced medicine for a decade, never running afoul, excuse me, of the credentials that he worked for, despite the fact that he was not a doctor. But then he applied for privileges at Ingram Regional Medical Center in Lansing, Michigan, my hometown. Hi, Michigan. That's where he found out that a good credentialing program can be quite a hurdle for a fake doctor. All right, I'm not going through this. So he was 39 years old. He pleaded guilty on July 15th in Ingham County Circuit Court to a felony charge. He faced up to 15 years. I am really skimming. I looked at my pile of topics and was like, you have to do one. So here we go. In addition, he faced penalties up to $100,000. What did he do? Well, Roque claimed on state licensing applications in his curriculum vitae, that he was a 1996 graduate of Rush University Medical School in Chicago, but the school says that he's never attended. Prosecutors also say Roque used forged documents, including medical board test scores to gain admission to 4 residency programs in Michigan, Ohio, and a Canadian province. Hospitals where he worked report that Roque participated in more than 300 operations, including heart transplants and amputations, though his exact involvement in those procedures remain unclear, prosecutors say. So, you about to go in there and get your hip removed. You think it's a regular smuggler. This a regular day. I'm going in. They're going to keep me for about 2 days. I'll see you when I get out. If you come see me, come see me. Bring me some Popeyes. Yeah, okay. But you don't know that so-and-so has been cutting on you and ain't got a lick of nothing. We're going to get into... All right, moving on. This is from... I don't know. Somebody named Sarah Netter was posted on April 30th, 2009. I hit the print button and that's it. I don't know. But Sarah posted an article called Fake Doctor. Oregon man charged with performing surgery without a license. So it happens. It happens. And so let's get into us. It's scary when I say us. I mean people of color. Others may. I don't know. People of color, we find a need to do things to make ourselves feel better, but we don't look into the pros and the cons. And I always use Kanye West's mother as an example in my mind. I always think about that because when Kanye West's mother, Donna West, went in for a procedure, and the first doctor turned her down because he said, you know, you have a history of cardio, your heart. You have a history of heart stuff going on, so I'm not gonna mess with you. That's a good doctor. A good doctor will look at all the data and say, you know what, I'm not gonna work on you because, you know, I'm just not. You're not, you know. So Miss West went to somebody else. They did the procedure, and unfortunately, she passed away. Okay. So what I'm saying is, if you decide to do something like this, you got to be careful. Do not go if they're not board certified. Don't get with them. I don't care. It's like you putting a discount on your life. So you want a discount on your body. All right, so this article, Fake Doctor, the Oregon man charged with performing surgery without a license. So, excuse me, May 1st, 2009, police in Oregon, they were looking for more patients from a man that was practicing without a license. So, Scott Hansen, 22 years old. This was back in 2009 from Cooked Rich Ranch, was arrested Tuesday and charged with 6 accounts of identity theft, third-degree assault, forgery, tampering with drugs records, and multiple accounts of theft after one of his patients, a friend, realized he was not a doctor and he had told her and one of her other patients. This goes so far into it, I'm not going to go into it, but apparently he kind of robbed them as well. Oh goodness, what did I do? Okay, an exam and prescription medication which he dispensed on the spot. Who is McNaughton? McNaughton is Brian McNaughton, who is a Redmond police captain, he told the NBC News that police know of the 3 patients, but they believe that there are no more. Who knows how sterile any of the instruments were, he said, noting that these people were at risk of infections or worse. Quote, if you were treated by this individual as soon as possible, unquote. So back to this person. I'm reading and thinking and breathing and blinking and whatever. What I'm saying is, okay, McNaughton said patients, quote unquote, cost around $50. The surgical procedure. There was only one police aware of involved, maybe cutting of some skin or stitching things up, McNaughton said. I don't know. I'm not doing this. I think he's trying to minimize his role in it. I think he's trying to say, well, I'll just stitch some stuff up or whatever. I ain't do nothing. What? The charges of sexual abuse and harassment stemmed from one of his exams. So somebody, I'm skimming, somebody apparently accused him of that, and he said he declined to further detail what led to those charges. All right, so I'm gonna get into anesthesia in 1 second. All right, so back to quacks. We have to be careful with quacks. I call them quacks. They're doctors that are really not. And some physicians come here properly trained in a different country, and they come here and then they have to either redo an exam, or they have to redo some things, or come up to U.S. standards. There are some that don't do that. They will come over here and will practice just like anybody else without updating their licensure. You know, they just kind of come over here, whatever. And then they say, hey, you want a BBL? You want a breast lift? You want a tummy tuck? I got you. I'm going to knock off $200 or whatever. So it's like some discount, and then we be like, oh God. Or Americans will go to a different country where they are not board certified just for a discount. And we have to be careful with that, because people are losing their lives out of vanity. It's one thing, I always said, if I was born a certain way, my genes, my genetics, my God, my cells, whatever made me me. If I grew up and I'm an adult, I'm a woman now. If I got junk in my trunk and a 6-pack to match and this and that and the third, if that's what's given to me, I'll take it. Okay, this is what it is. I can't help that. But if I turn around and be like, you know what, I'm going to risk my life. I'm going to pay money I really shouldn't be. And I'm going to go out and do this. For what? That's where it come back to my mind. You could do that. You could do that. That's cool. For what? So when you go down the street, when you walking down the street, what does that do for you? This is what I would love to ask any woman or man that wants to alter their appearance. When you walking down the street, how do you feel? When you taking the garbage out, how do you feel? When you walking to work or driving, or you run to the bank, or the, you know, wherever you go, don't nobody care where you going. When you going where you going, how do you feel? If you feel in yourself that I need something outside of myself to make me feel sexy, desirable, pretty, special, whatever it is, that's a dangerous road to go down. If you cannot walk down the street minding your own business, and you need somebody to tell you you look good, you need somebody else to be like, you need somebody else to say, hey, you know, you need somebody to catcall. That's how you, so when you get from all running around, or you going to the big show, I don't care if it's to the bank or the big show, whatever. Do you really in your mind think like, you know what, when I step outside, somebody has to validate me. Somebody has to say something to me, whether it's positive or negative. As long as I get something, it makes me feel better. We got to get it together as a people. If you can't walk outside, if you walk outside and you really be like, okay, who gonna say something today? That's messed up. Because guess what? Before you walked outside, you should have already known. And whoever got something to say, that's just their opinion. You should know when you walk out, I'm good. I'm cool. I'm all right. I don't believe, I can't tell nobody what to think. When I walk outside, I'm good. Good, bad, and different. Okay? And I'm going to come back home. So when you thinking in your mind like, you know what? I'm going to go to a different country where it's not really certified or board certified, and I'm going to do it. I'm saving $2,000 and I'm going to come back fabulous. I hope you come back. You know? Then when you get back, you halfway look the same when you left. That's the key. That's the key. You go through all this and you halfway look the same any old way. Okay. All right. I told somebody very close to me, I said, look, if you ever hear me talking about getting a nose change, slap me. And she know who I'm talking about. I told her, I said, if you ever hear me talking about getting anything done, slap me. Because I'm not about to get out here and let others make me feel like I'm inferior or I'm less than. Because I'm beautiful. Inside and out. I said it. I'm beautiful. I said it. Inside and out. If you're having a problem with that, I would seek further. You can do self-help or you can seek a professional. Either way. All right. So back to, okay. So now this is a little bit different, but it's still on the same. When you go get an operation and you go under anesthesia, and there are doctors for that. I knew about this, but before I knew about this, I didn't know about this. Okay, I didn't know. That was weird. When I learned about this, anesthesia is called anesthesia awareness, anesthesia awareness, twilight anesthesia, and just general anesthesia. I've been under general anesthesia before. Where are my glasses? So, for those that don't know, it's a medically induced coma with loss of protective reflexes resulting from the administration of either intravenous or inhalation, general anesthetic medications, often in combination with an analgesic and neuromuscular blocking agent. Okay. It is generally performed in an operating theater to allow surgical procedures that would otherwise be intolerable, painful for a patient, or in an intensive care unit or emergency department to facilitate the endotracheal intubulation and medical ventilation and critical ill patients. All right. When you go into the get cut on, they put you under, basically. And there are doctors that know how to do it. So, anesthesia, that's a good thing. How would we go through, get cut on and fixed and stuff without that? Now, there's a whole thing. You could be sometimes the anesthesiologist, either they get it wrong or just human error, whatever the case may be. You think you under, you are awake. So I saw this years ago on 2020 or whatever outlet I love or whatever. This lady was on there saying that she was under the knife, but she was physically not feeling them, but she was up. She was straight up woke. And I'm not sure if they're putting things in place to ensure that this doesn't happen. But, okay, let's start with twilight anesthesia. Twilight anesthesia is an anesthetic technique where a mild dose of sedation is applied to induce anoxylus, ANXIOLYSIS. In parentheses, it has anxiety relief, hypnosis, and good Jesus, anterograde amnesia. In parentheses, inability to form new memories. Okay, crap. And so basically, they know how to get you in a state where you know, it's anesthesia. You didn't feel nothing. You ain't gonna know. You come out and your appendix is gone and we good. You ain't, no. The patient is not unconscious, but sedated. During surgery or other medical procedures, the patient is under what is known as a twilight state, where the patient is relaxed and quote-unquote sleepy, able to follow simple directions by the doctor, and is responsive. Okay, so when I went under once, that's what they did. They did the whole countdown from 10. I was there with them. I know what they said. I did what they said. I don't remember after 7. After 7, really don't, you know. All right, so it is used for, and then I woke up later, but okay. It is used for a variety of surgical procedures and for various reasons, just like regular anesthesia. Well, twilight anesthesia is designed to help a patient feel more comfortable and to minimize pain associated with the procedure being performed, and to allow the medical practitioner to perform without interruptions. So, twilight anesthesia is different from regular. Overview. I'm still on Wikipedia. Overview. Twilight anesthesia is also known as twilight sleep and confers as any easy awakening and a speedy recovery time for the patient. Anesthesia is used to control pain by using medicines that reversibly block nerve conduction near the site of administration. Therefore, generating a loss of sensation at the area administered. Okay, it goes on. So twilight anesthesia is different from regular anesthesia. And now I'm wondering, is there a different format? Like when you walk in, do they be like, oh no, give her twilight and give him general? Okay. Anesthesia awareness. So this is what I was talking about when you're up and they working on you and you know it. Awareness under anesthesia, also known as intraoperative awareness or accidental awareness during general anesthesia, AAGA. So they know this is happening. It's a rare complication of general anesthesia where patients regain varying levels of consciousness during their surgical procedures. While anesthesia, I almost made that a girl's name, Anastasia. While anesthesia awareness is possible without resulting in any long-term memory, it is also possible for the victim to have awareness with explicit recall, where victims can remember the events related to their surgery. So you up here getting cut on and all that, and took your spleen out, and you know. Signs and symptoms. Intraoperative awareness can present with a variety of signs and symptoms. A large proportion of patients report vague, dreamlike experiences, while others report specific intraoperative events, such as, hearing loss, hearing noises or conversations in the room, remembering details about the operation, sensing pain associated with intubation or surgery, having weakness or muscle paralysis, feeling anxiety, helplessness, or an impending sense of doom. So you laying there and you know it's happening. Can't feel it, but whatever. Patients under anesthesia are paralyzed if a neuromuscular blockage drug, a type of muscle relaxant, has been given as part of general anesthesia. When paralyzed, patients may not be able to communicate their distress or alert the operating room staff of their consciousness until the paralytic wears off. After surgery, recognition of the symptoms of an awareness event may be delayed. I'll tell you next week when I remember it. I remember when you cut into my thing. I remember. Depending on the awareness experience, patients may have post-operative psychological problems that range from mild anxiety to post-traumatic stress disorder, PTSD. PTSD is characterized by recurrent anxiety, irritability, flashbacks, or nightmares, avoidance of triggers related to the trauma, and sleep disturbances. So, you can go into this, come out next week, be like, hold on, man. I remember hearing somebody say, pass the sponge. You know what I'm saying? Like, you can remember stuff. Somebody like, oh, cold blue. You like, what? You on the table like, what? They talking about me? Light anesthesia for certain operations such as cesarean section. I'm a cesarean baby. Or in hypoglycemic patients or patients with minimal cardiac reserve, the anesthesia provider may aim to provide, quote, light anesthesia, and should discuss this with the patient to warn them. Okay, moving forward, there's an error. Anesthesiologist error. Human errors include repeated attempts in intubation, during which the short-acting anesthetic may wear off, but the paralyzing drug has not. Okay, errors. Other causes of awareness include unfamiliarity with techniques used. Basically, it's people that don't know what they're doing. So you have an anesthesiologist error. You have light anesthesia. The errors, oh God, equipment failure. Machine malfunction or misuse may result in an inadequate delivery of anesthetic. Many Boyle's machines used in many hospitals have the oxygen regulator serving as a slave to the pressure and the nitrous oxide regulator to enable the nitrous oxide cutoff safety failure. If you followed that. If nitrous oxide delivery suffers due to a lack in its regulator or tubing, an inadequate mixture may be delivered to the patient, causing awareness. Many World War II vintage Boyle F models are still functioning and used in UK hospitals. Their emergency oxygen flush valves have a tendency to release oxygen into the breathing system, which when added to the mixture set by the anesthesiologist can lead to awareness. This may also be caused by an empty vaporizer or a malfunctioning intravenous pump or dysfunction of its, oh my God, malfunction. I'm sorry. Breathing can lead to, okay. This may also be caused by an empty vaporizer or a malfunction intravenous pump or discontinuation of its delivery tubing. Patient abdomen causes some cause of awareness and death. Okay. Equipment failure, human error, patient physiology. I'm not getting into that. You could be unhealthy, and it just works that way. So, wow, 38, 32. Don't like those numbers. So that's about it. I think we're gonna go because I have to be consistent. I like 50 minutes, but Wikipedia goes into the criticism of quackery. Yeah, the history in the U.S. Okay, I'm about to call it quits. How's your day? Mine is great. Thank you. I'm getting off. Anyway, so just be careful if anybody is thinking about going under the knife. Make them board certified. Don't do a discount on your life. And I'm sitting here waiting 20 seconds. And just be easy. I'm waiting. 5, 4, 3, 2, 1. Okay, guys. Bye. See you later.